I just got myself vaccinated. I have received this card, which essentially gives you your date. Um, so I was vaccinated on the 30th of December, and I'm scheduled to go after 3 weeks, which will be the 20th of Jan. I was given this form. Sorry for condition, but this is the form that we were asked to fill, and it's from Public Health England, Healthcare Worker Covid-19 Vaccination Consent Form. Well, I wish they had let us know about this form, so I could have, filled and signed this form at the convenience of my home and come there directly to get vaccinated. This is something that could have helped, but otherwise, I have to say that the experience was excellent. Very smooth, very helpful medic and paramedic staff, and also volunteers whoever helped with the parking. Very cheerful, very professional. Social distancing was reminded at every point, and sanitizers were there. There were no pens, but I can understand given the current situation. Now, I wanted to go through a few of the things that I noticed. They were very patient enough to explain certain things, and there was some questionnaires that they asked me before I got vaccinated. So, just to give a perspective, prior to going to this place, I was given an email. I was sent an email stating some of the criteria for vaccination. Number one is the fact that I hadn't been infected with COVID in the last 28 days. So I was positive prior to that, so I'm eligible, being pregnant, and a few other criteria. Now, once I went to meet my nurse, there were 10 cubicles in this place, and the cubicle in which I went, the very pleasant nurse asked me a few questions, and I would like to read out those questions for you. So the number one question that they asked was, have you been diagnosed with COVID in the last 28 days? Number two, are you currently unwell with fever? Number three, have you ever had any serious allergic reactions? And this is clearly because they wouldn't proceed with giving you a vaccine in that case. Next, have you ever been prescribed an adrenaline auto injector such as an EpiPen? So for those of you who don't know, EpiPen is a device which is life-saving for people who are known to have very severe allergic reactions in the past, including nut allergies. So if you are one of those kind of patients, then they would not be vaccinating you. Just for your information, I got vaccinated with the Pfizer brand. Number five, are you or have you been in a trial of a potential coronavirus vaccine? So as you know, we have two companies at the moment here in the UK that is having a priority. One is the Pfizer, and the other is the AstraZeneca Oxford vaccine. So if you are receiving vaccines from there, then it would not be appropriate for you to get vaccinated by the Pfizer, especially if it's done in a spectrum of close vicinity of a few days or so. Now, are you or could you be pregnant, breastfeeding, or planning to become pregnant in the next 3 months? Again, if yes, they would not proceed. Are you taking anticoagulant medication, or do you have any bleeding disorder? This is simply because just gives the nurse an alert regarding complications. The needle size, just for the benefit of the public, it is the blue needle. The blue needle, which is not small, and to be honest, I was expecting something like an insulin pen needle, which is very fine. This was quite a size, but having said that, she was very professional, and I didn't feel any pain as such. It was injected on my upper part of my shoulder muscle, known as the deltoid. Um, have you had any vaccinations in the last 7 days? So, if you had vaccination in the last 7 days, especially influenza virus vaccine, um, they wouldn't proceed by giving you this vaccine. Now, the nurse was very kind enough to ask me if I had any questions, and I did ask some questions because I was a doctor, and I felt that it's always best to get this information from the medics who are actually delivering the vaccine, as sometimes their information is a bit up to date. So what she told me is that, so my first question to her was regarding the efficacy of this vaccine in terms of the duration. So what she told me is, to the best of her knowledge, they are not sure on how long this would last, but they predict that this will be similar to an influenza virus vaccine, which means it will be given once a year. The other thing that the audience to this channel needs to know is that the influenza vaccine is not just a one-off injection. You two sets, so two injections that you will be receiving 3 weeks apart, and you will only be completely protected, so to speak, after the second jab. In my case, that will be on the 20th of January. I did ask about AstraZeneca's vaccine. There's a lot of hope for it. We're not sure about the details, whether that's going to be a one-off, whether that's going to be 2 injections. We have no idea. But what she said is, because there are so many new strains coming out, it's very likely that we'll be needing to get a jab every year. Full stop. What else? I asked her what are the common side effects, and she told me that the most common side effect that they were seeing were the pain in the area of injection. Fortunately, I don't have that. Number 2 is fever, for which she said there's nothing to worry, just take some paracetamol and just crack on. I'm on call actually a few days from now, and this was a bit worrying, knowing that I'm taking the vaccine a few days before, but I felt very reassured knowing that that I am safe and I'll be functional to go to work. If there's any more points that I remember and I would like to mention, I will put it up with my second follow-up video on my second jab, which will be on the 20th of January. And if there's any questions that you all have, please do ask me questions. And if there's any topics that you would like myself to discuss, let me know. I am essentially a specialist registrar. I'm doing diabetes and endocrinology along with general internal medicine in the Cambridgeshire Deanery. I am working the hospital called Princess Alexandra Hospital in Harlow at the moment. Thank you, and thank you for listening to me. We'll try to come up with similar videos with different topics, and we'll take it from there. Thank you.